This meeting is now being recorded.
So I'd like to welcome everyone that's listening to this recorded webinar by InterAct LifeLine. We had several very good webinars in the last week where we invited people that wanted to learn more about what we were up to, people that were already involved with the company, and those that were considering an investment with us learn about our company. So in this recorded webinar, we're going to go back over the information that we presented live and attempt to answer some questions that were brought up by the participants that were on our live calls. So as we start, my name is Carolyn Bradfield, and I wanted to share a little history of how InterAct began, focusing on our corporate history and why we decided to jump into this marketplace. InterAct LifeLine was created last year in 2019, and it's a wholly owned subsidiary of Convey Services, a portal technology company that has been offering services to thousands of telecommunications and insurance agencies and their master agencies for the last 6.5 years. As many of you may already know, I lost my daughter Laura to overdose in late 2017 after a difficult 15-year struggle with addiction. For a year after her death, I began writing about the lessons I learned through that struggle, and in 2019, I engaged in a research project to determine if the technology we built at Convey could be useful in helping programs treat the disease or parents prevent their children from misusing substances. And from that research, we decided to create InterAct LifeLine as a technology solution to address the deadly and growing opioid and addiction crisis. So you're going to hear from three of us today. As I said before, I'm Carolyn Bradfield, and over the last 3 decades, I've been a serial technology entrepreneur, founding and exiting 4 companies, 3 of them in the conferencing and collaboration space, and one of them, Phoenix Outdoor, was a licensed North Carolina treatment program for adolescents that were struggling with substance abuse and addiction. Curt, whose picture is in the middle, has been a board member of Convey Services since its inception and is a board advisor for InterAct. Curt has both entrepreneurial and big company experience in technology, particularly in the telecommunications and cloud industry. He just exited his role as the president of strategic channels for Windstream Communications, a $6 billion telecommunications and network provider, helping guide the company through bankruptcy and keeping their partner channel intact through the process. Bruce Ahern is also an accomplished entrepreneur, and in full disclosure, as my husband, we're also business partners. He started and sold companies in technology publishing and diabetes management and the clinical trial space. Bruce has also partnered with me in the conferencing and collaboration businesses we've run, and now with InterAct LifeLine. So one of the most important things a business can do is to be very clear about who we are, the problem that we're solving, and how big that problem is, and why it deserves our attention. So I'm going to turn it over to Curt Allen and let him pick it up from there and address what InterAct's mission is and why this problem is so worthy of being solved. So Curt, I'll let you pick that up.
Thanks, Carolyn. At InterAct, we see ourselves as a technology company bringing solutions to a marketplace that, in our opinion, is woefully underserved and certainly automation challenged. Our solutions are designed for the addiction treatment industry, for the collegiate recovery communities, and as a prevention strategy for parents to better educate, monitor, and protect their children. You can't turn on a news show today without hearing how the opioid crisis and addiction have turned so many lives upside down. Humans have been abusing opioids for hundreds of years, as we know. Opioids are arguably the most effective pain management substance ever discovered, but with very dangerous side effects, quite frankly, addiction and acute mortality. This latest opioid crisis, in our opinion, started around 1996 when Purdue Pharma brought OxyContin to the marketplace and then marketed it aggressively with what have turned out to be false claims that it was safer than traditional opioids. Abuse was rampant and the whole pill mill industry was born. As we would expect, government began to crack down on overprescribing, and addicts were forced to turn to heroin because it was cheap and produced similar results. Fast forward to today, it'd be hard for you to find people that don't have a family member, friend, or coworker struggling with addiction. It's estimated that over 22 million people have the disease and need treatment. Unfortunately, the data also shows us that going to rehab 30 days and resuming your life afterwards doesn't work. 85% of people will need to go back for more treatment because they relapse. And often those relapses are deadly. Addiction is a progressive disease. More people die each year from overdose than in the combined deaths of the Vietnam and Gulf Wars. Hear that again. The combined deaths of the Vietnam and Gulf Wars don't equal a single year of mortality tied to the opioid addiction crisis in this country. And it's costing us dearly. You add up the healthcare costs, lost productivity at work, the law enforcement incarceration expenses, and you're looking at $1 trillion impact to the economy. InterAct knows this is a big problem and not getting any better, and it needs a new thought process to address it. There are 3 things we can do to improve how people are treated, how they maintain health, and how families can be part of the process. First, addiction is a chronic disease. It doesn't get cured after 30 days in rehab. If you can keep people connected to treatment longer as outpatients, the relapse rate drops significantly, and people have a chance to create a plan for long-term successful recovery. We also know that connections to community are vital for recovery. However, sometimes it's difficult for those in recovery to get connected. That's where technology can make a huge difference by offering virtual connections to community when face-to-face connections are not always possible or feasible. And last, and certainly not least, family understanding and support is critical. When people go to treatment, the family may have a brief family half day, but it's just not enough to give them the understanding and support they need to be a good partner for the person who is struggling. Again, technology brings education, support, and the resources online for those families. We also believe that parents are critical to helping prevent substance misuse that leads to addiction. So we'll talk a little bit later about how our service is the perfect prevention resource for parents and families.
All right, so Curt, I'm going to pick it up from here and talk about what InterAct's technology is designed to do. So you heard Curt just say that extending treatment is very important to recovery, but most programs struggle to do that. If you provide more care by having someone stay in your facility, then that becomes quite expensive and often not really practical for most families. What InterAct LifeLine allows programs to do is offer additional care when the patient has gone home and automate the process for treatment programs so that they can keep their clients connected and cared for. Our technology is completely managed for the program and offers the essential elements of extended treatment. First, we offer content and education so that parents and the clients can understand addiction as a disease, what it takes to be in recovery, and wellness strategies. The system also automates engaging and communicating through messaging, surveys, and reminders. So we're constantly outreaching to the clients and their families. Many of the clients, once they leave that 30-day, very structured rehab program, struggle with structure and accountability. And now with InterAct, programs can help clients schedule their time and commitments, automatically remind them to show up, ask for them to check in, and monitor how they're complying with this extended care program. And as Curt also mentioned, we keep people connected to community, and community is vital to the recovery process. Technology can provide online forums for both parents and clients and virtual support groups. And in addition to that, we can connect clients to telehealth sessions for medication-assisted therapy or other clinical needs. One of the questions that we were asked in prior calls was the question about insurance reimbursement for some of these services. And we at InterAct think that the pendulum is swinging back the way of having insurance companies more amenable to reimbursing. In 2019, the law changed, making telehealth sessions reimbursable. So we think there's a pathway for insurance companies to partner and reimburse for their clients. I have a particular passion for what the family is going through as they try and cope with helping their addicted loved one. And as you can only imagine, as I disclosed my situation with my daughter, Laura, I was one of those families. From what we know in running our treatment program and working with other families, we understand that they're experiencing trauma, stress, grief, shame, and a range of other emotions that they need help processing. not to mention what they need to do to help their loved one in the recovery process. They need to be additive to that whole process. InterAct creates a robust family support service that programs execute using our technology. As I said before, our service allows for parent discussion forums and virtual support groups. We provide high-quality education and content that's constantly refreshed, and we outreach to parents to let them know to come look at it, so we keep people engaged. And we can connect families to therapy through telehealth sessions that are most often reimbursable by insurance. Our treatment program, Phoenix Outdoor, that I mentioned, that was sold in 2007, had an advanced family support program that we executed entirely through technology because our families and clients were coming from all over the country. When we sold the program, and by the way, it is still up and running in North Carolina, the entire outdoor behavioral health care industry changed how they executed family support by adopting our model. So we're really proud of that. And then, as Curt said, there is no doubt that addiction is a difficult and deadly disease. And most often parents are not as aware as they need to be about what's going on and the risk that it presents to their children. So here's a statistic that I think will really scare you a little bit, which is that 1 in 10 children become addicts before they leave high school. 1 in 10. So that's a huge number. And one of the most significant things that we're going to do is offer a program called SafetyNet, which is designed specifically for prevention. It combines this high-quality education with mobile technology that tracks and monitors children, and most importantly, equips these children with wearables that are already on the marketplace that will monitor their heart rate and blood oxygen levels. And when we do that monitoring and we see those levels get out of range, we know that that individual, that child, is at risk for potential overdose. And so, again, we can alert and send help. We also will offer the same connections to therapy, specifically family therapy and telehealth. So when you wear a fitness tracker, an Apple Watch, a Fitbit, a Garmin, you most often care about your steps and your fitness. When an at-risk teenager or young adult has one on, our technology cares what their heart rate and blood oxygen levels are and making sure that they're normal. And any medical professional will tell you that once the heart rate starts going out of control and blood oxygen drops, that's an absolute sign of overdose. If the technology had been available 2 years ago, it would have saved my daughter's life because she was only a mile away from the hospital when she overdosed and help was not sent in time. Because our company was an outgrowth from Convey Services, a company that's been in the business since 2013, we are fortunate that we already have technology that's been proven in the marketplace. We're using that online portal technology and the network that connects portals to a centralized site to offer a continuous feed of high-quality content that we've spent the last year curating from great sources like Harvard Medical and SAMHSA. Portals are customized for each individual program and automate how data is kept on clients and family, how it outreaches, and how it messages individuals. Programs often struggle to know if what they're doing is producing the right result. And because technology tracks and collects data, these programs can now produce outcome studies that show results. And especially because we're extending care, programs can follow their clients for much longer periods of time. We have decided to integrate with a currently existing mobile platform that's already being used in medical health care. And that platform offers geolocation, check-ins, surveys, and HIPAA-compliant secure messaging. The bottom line is that our technology is proven, it's being used in pilot programs today, and it allows us to get into the marketplace right now without extensive time in technology development. So I'm going to turn the call over to Bruce. And Bruce, what I want you to talk about is the size of the market that we're in and what our revenue model is.
Well, thank you. As Carolyn and Curt have already said, we exist to extend treatment, offer connections to community, engage and educate families, and help parents protect their children. We believe that we can have a huge impact in three very significant markets. We're beginning right now in a small but very high profile market, collegiate recovery. It's a proof of concept of our solution. There are around 4,300 colleges in the United States, many of which have already adopted collegiate recovery programs. Our revenue model is to sell our services as a subscription, which can be funded by grants and donations within each one of the schools. The second key market is treatment program, which is much larger with almost 14,000 programs. We want to make it easy for every program to adopt our extended care and family support program. So whatever they charge their clients or families, we will take 1/3 of that revenue. And by far, the most interesting and largest market that we're getting into is SafetyNet. This is the consumer program we're going to be offering and releasing later this year to parents who will pay a low monthly subscription to have access to a cafeteria list of services, including education and monitoring, tracking, and safety support. There are around 42 million kids between the ages of 10 and 19 in this country that deserve to be protected. With the low cost entry of each family, the market potential for this is by far the most significant. Looking at collegiate recovery, we have already launched pilot programs in 6 major colleges across the US, including Kennesaw State here in Atlanta, Alabama, and Virginia Commonwealth, which is my alma mater. We've gotten the attention of the National Association of Collegiate Recovery Programs, who are willing to endorse us and become a channel partner to help get our technology in the hands of their growing membership. We also have the attention of a very well-funded national nonprofit called SAFE Project, whose goal is to have 1,000 colleges create a collegiate recovery community. They have also expressed interest in purchasing our technology and making it available to colleges that want a safe campus program. The next phase of this is to roll out within the collegiate or the treatment programs that are notoriously unautomated and lack technology to offer extended care or family support. There are 1.3 million Americans that go through rehab each year, making it a very large marketplace. Today, we're bringing up the first pilot programs with Next Step Recovery in Asheville, North Carolina, and Talbot Recovery, a very large program right here in Atlanta. As Carolyn shared, 1 in 10 teens will become addicted before they leave high school. Laura began her addiction at age 14. This is a story we hear over and over again. SafetyNet has the greatest revenue potential of anything we're working on. With only 1% market share, with the 42 million adolescents in the US, SafetyNet could produce upwards of $300 million in revenue. We know that SafetyNet is perfect for strategic partnerships and distribution relationships such as PTAs, schools, sport programs. The list goes on and on.
Okay, I'm going to pick it back up from here, and I want to share what we're doing in 2020 so that you understand that we've really got 3 tracks running: refining technology, completing our pilot programs, and launching in the marketplace. So let's start with technology first. And one question we got in prior webinars were, what were some surprises that we had in our pilot programs? Well, one of the biggest things that we learned was that there was a higher level of compliance that we needed to achieve because we're working with government organizations like colleges and with mental health care companies. And so we're tweaking our existing portal technology to add more security for programs, make sure that we are web accessible so that we are ADA compliant, and we have HIPAA compliance locked down. We're also, again, not building the mobile platform, but we're going to connect to an existing one. So that's, again, a refinement that we need to make. Later in the year, we would like to build our own mobile application for SafetyNet. We think it deserves a completely different look and feel, and then integrate with the data stream produced by the national wearable company that we're going to partner with. And again, as I pointed out before, if you're wearing one right now, a Fitbit, Apple, or Garmin, you may not realize it, but they're tracking your vitals all the time. And we just intend to take that information, reinterpret it, make sure that we know when someone needs help and how to send it. And as you've already heard, we're deep into our collegiate recovery pilots and beginning our treatment pilot programs. This gives us the insight we need to adjust and make ourselves market ready. So, Curt, I'm going to turn this back over to you and give people the reasons that they need to look at as a potential investment in InterAct LifeLine. If they're interested, why would they invest?
Great. Thanks, Carolyn. Certainly this is the ask part. And, I would say to everybody listening to this, all of us have been touched by addiction. And I think we all wish we could do something. And we at InterAct LifeLine are giving you that opportunity to do something, to make an impact, improve recovery, reduce relapse, prevent deaths. But let's be clear on this. We know the best way for us to deliver these solutions to the largest number of people and get the highest number of good outcomes is to build a wildly successful and profitable business. And we have the plan in place to do just that. And the market opportunity is huge, as Bruce laid out for you. So, trust us. Like we want you to invest with us because we need capital to get this thing up and going so we can help people. But this isn't charity. There's a massive opportunity to get a huge return on your investment. And I won't steal too much of Bruce's thunder, but we think we've designed an instrument that makes your participation very easy. It's a really flexible model to participate, a debt that could be converted to equity and those types of things. I'll let Bruce get in deeper on that. But we need your help. And like I said, we're not asking for charity. We're asking for investors, and we think there's a huge return.
Before I turn it over to Bruce, I want to make sure that anybody that's interested in an investment with InterAct is educated and informed. And as such, all of our investor information is online at interactlifeline.com. All you have to do is go to the page that says Support InterAct, hit the drop down, and then go to Invest. And so, Bruce, what is available for people to look at, and how do they get connected to us for an investment?
Well, first of all, I agree with you. People need to take a look at what we're doing at InterAct LifeLine and understand the business model as completely as possible. The business plan lays out all of the market opportunities and gives you a lot of information. In order to invest with us, you need to be a qualified investor, and there's a link that explains exactly what that is. I'll reiterate, we are not a nonprofit. We get a lot of inquiries saying, well, we've allocated all our money for philanthropic things. This is not philanthropic. This is making an impact, but getting a return on your investment. Our investment instrument is designed for the maximum flexibility. It starts as a debt, and it pays you 8% interest. It allows you to convert your equity at a discount, or it allows you to be repaid should you not want to continue with an equity position. Everything, including our term sheet, is online at the website. All you have to do is click on the investor page to get more information.
So, in recap of our call, again, we appreciate you listening to the recording. InterAct is poised to help you turn your success into substance as we work together, bring technology to the marketplace to fight the opioid and addiction crisis, prevent people from developing the disease, and reduce the relapse rate and overdose deaths. We thank you for coming. Our website is interactlifeline.com. We have all of our contact information on the site, and we would certainly love to have an individual conversation with you. And if you want to join our journey, we're happy to have you. So again, thank you so much.